Type 2 diabetes meal plan. In this video, I'm going to talk about type 2 diabetes and share some really interesting facts about it. I will explain what causes type 2 diabetes and what is the best way of eating for someone who wants to prevent this condition or is already diagnosed with type 2 diabetes. By the way, if you're new to my channel, I'm a nutritionist and a health coach who shares practical, healthy living tips for people who are tired of the health and weight loss advice that doesn't work. If you enjoy watching this type of content, don't forget to like this video, subscribe to my channel, and click the notification bell so that you would get notified whenever I release new videos such as this one. Our bodies need to maintain constant blood sugar levels of around 100 milligrams per deciliter throughout the day. Normal blood sugar range can be between 80 and 110 milligrams per deciliter, which is equivalent to 4.4 to 6.1 millimolars per liter. According to Diabetes UK, the blood sugars of type 2 diabetics would be 7 millimolars per liter or more, which is equivalent to 126 milligrams per deciliter or more when fasting, and 11.1 millimolars per liter or more, which is equivalent to 200 milligrams per deciliter or more after meals. So let's come back to the normal ranges. Why do our bodies try so hard to keep the blood sugars at this level, between 80 and 110 milligrams per deciliter? Well, if you have too little glucose, you get hypoglycemia, which mostly occurs in type 2 diabetics when their blood glucose levels drop below normal. This can result in dizziness and confusion. Untreated severe low glucose level can result in seizures, loss of consciousness, or even death. And then on the other side of the scale, we have high blood glucose levels called hyperglycemia. In excessive amounts, glucose is toxic to the body. In type 2 diabetics, chronically elevated glucose can lead to various diabetes complications, including cardiovascular disease, nerve damage, kidney damage, eye damage, foot damage, skin conditions, hearing impairment, and Alzheimer's disease, just to name a few. Type 2 diabetes is a condition in which your body loses the ability to control blood sugars. Why does this happen? So first, we have to look at what foods we eat on a daily basis and how they affect our blood sugars. We can get energy from carbohydrates, protein, fat, and alcohol. In the presence of all of them, let's say you ate a meal that consists of carbs, protein, fat, and alcohol. Let's say you had a burger with fries and as well you had a can of beer. So you got your protein, fat, carbs, and alcohol. Your body will metabolize these in a specific order. The most toxic ones, the ones that your body doesn't want to keep for a long time, will have to be used first. So the alcohol will be used first because it is toxic to your body. Your body doesn't have what to do with it and wants to get rid of it as soon as possible to reduce the damage. Then we have glucose. Remember the damage that elevated glucose can create in diabetics? Even in healthy people. Your body wants to get rid of the glucose too. When you eat sugar, and by sugar I mean all carbs in your body get converted into simple sugar called glucose. You eat bread, it turns into sugar. You eat rice, it turns into sugar. When you eat sugar, it puts your body in an emergency situation where your body has to dispose of it first. Your body stores the glucose you get from the foods you eat for later in the form of glycogen in your muscles and your liver. And then the rest gets converted into body fat and stored in the adipose tissue. But of course, if you eat high-carb meals and snack between those meals, you will never have time to burn your own body fat. You live on the constant glucose supply by eating your high-carbohydrate meals and snacking between them. Then you have protein and fat left. These both have many different uses in the body. Your body can use protein and fat for structure, repair, production of energy, even production of glucose. You don't even need to get external glucose for your diet through eating carbohydrates, because your body can make its own glucose through a process called gluconeogenesis. But carbohydrates are one of the essential macronutrients. Well, if you look at the real science-based nutritional requirements, not the nutritional requirements created by our food industry, what you see is that we have 90 essential nutrients, meaning our bodies can't make them and must get them through our diets and supplements. As you can see, there are essential minerals, vitamins, amino acids that you get by eating protein. There are essential fatty acids that you get by eating fat. And I don't see any carbohydrates in here. Why? Because they are not essential. We can make the little amount of glucose that our bodies need to maintain those normal blood sugars by eating enough of protein and fat. The proof? What happens when you eat a very low carbohydrate ketogenic diet that has 20 to 50 grams of carbs a day? Or when you go fully zero carb? Nothing bad happens. your health improves drastically. The amount of glucose that we need to maintain our normal blood sugar levels is equivalent to around 1 teaspoon of sugar. Why do most people get 20 teaspoons of sugar a day? And keep in mind that this is only the added sugars. What about the rest of the carbs in your diet that will also get converted to glucose? The 200 to 300 grams of carbs a day that most people get, as recommended by the dietary guidelines. Imagine what's happening with your blood sugar levels if you eat this much of carbs. With this way of eating, I'm not surprised that 35% of the adults in the UK, which is around 1 in 3, have prediabetes, and 6%, which is 1 in 16, have type 2 diabetes. So as you get 200 to 300 grams of carbs a day, what happens? In general, around 90 to 100% of the carbs that you eat appear in your bloodstream as blood glucose within minutes to hours after you have eaten your high-carb meal. And it includes both starches that break down slowly into blood sugars and simple sugars that break down into blood glucose straight away. Whenever you eat these high-carb meals, you release the hormone called insulin. It comes in to take the glucose from the blood and put it into the storage. Insulin is the hormone that prevents your blood sugar levels from going above the normal ranges. But the more you eat these high-carb meals, the more your body can't cope with it anymore, until you get a condition called insulin resistance, which is basically a mechanism your body uses to prevent the toxic sugar from invading your body. You have 5 to 7 times more insulin with insulin resistance, trying to cope with the toxic amount of sugar you get from each of your meals. And you don't even need to be diabetic to experience the damage of high blood glucose levels and high insulin levels. They are at the root cause of many chronic health conditions, including type 2 diabetes, cancer, dementia, heart disease, and a lot more. But we need carbs for energy, right? It's the only source of fuel we can run on. Well, there's something you need to know. There are 2 types of fuels our bodies can run on. We can use either glucose or ketone bodies. Glucose is a way dirtier type of fuel that gives you less energy and more free radicals. Ketones are a superior type of fuel that gives you more energy and less free radicals. 85% of your body can run on ketones, and the rest, 15% of your body, can run only on glucose. And our bodies can create that glucose. And keep in mind that a low-carb keto diet involves eating a lot of vegetables. You can still get around 50 grams of carbohydrates a day, which is equivalent to 5 to 10% of your daily calories. And our bodies are not designed to run on an emergency energy source, glucose. No one talks about it, but the #1 cause of type 2 diabetes is a high carbohydrate diet. What's the relationship between the two? Low-carb, high-fat ketogenic diet has been shown to put type 2 diabetes into remission. Your blood sugars and insulin go to normal levels within weeks or months from starting a low-carb keto diet. You remove the root cause of type 2 diabetes, which is high-carb foods, and you put type 2 diabetes into remission. Your numbers indicate non-diabetic state. And if you introduce back the high-carb foods, what happens? Your body goes into a diabetic state again, which is a direct cause and effect. Many doctors and dietitians would tell you to keep eating carbs that will raise your blood glucose too high. Then take your medication to lower the blood sugar. Keep raising it and lowering it with medication. And this will get out of control over time, and you will be at a very high risk of getting the earlier mentioned diabetes complications. Keep in mind that the regular treatments don't remove the root cause of type 2 diabetes. It only masks the symptoms. So finally, let's look what is a perfect diet for type 2 diabetes. If you check websites such as the Mayo Clinic, a well-known, reputable website, what they advise you to eat is, for breakfast, whole wheat bread, 1 medium slice, 2 teaspoons of jelly, half a cup of shredded wheat cereal with a cup of 1% low-fat milk and a piece of fruit, and a coffee. Okay, tons of sugar, very little to no nutrients. Let's move on. Lunch, roast beef sandwich on wheat bread with lettuce, low-fat American cheese, tomato and mayonnaise, medium apple, and water. Also, very high amounts of sugar and very little nutrients. What's next? Dinner. Salmon with 1.5 teaspoons of vegetable oil, small baked potato, half a cup of carrots, half a cup of green beans, medium white dinner roll, and sweetened iced tea and milk. Why would you have a dinner roll here? They recommend dinner rolls for diabetics. Very interesting. And the snack, wait for it, 2.5 cups of popcorn with 1.5 teaspoons of margarine. Horrible. They are recommending all of this junk food to someone who's already ill. My point here is that it's totally non-science-based dietary advice, and you should stay away from these type of dietary recommendations, even if it's a doctor or a dietitian telling you to eat bread, rice, pasta, and potatoes. Keep in mind that they missed out on something really big here. Find another doctor or a dietitian, because these ones don't have any clue of what they're doing. What you should actually eat if you want to put your type 2 diabetes into remission is the opposite from what the dietary guidelines recommend. You need to reduce your carbs as much as possible and increase your dietary fat. Most of your plate has to be non-starchy vegetables. Add some healthy protein such as high-quality meat, fish, or eggs, together with some healthy fat. Very simple. And if you want a detailed explanation of how to start a clean low-carb keto diet, you can watch my other video where I explain it. I explain what foods to eat and what foods to avoid. You will also find my keto grocery shopping list and a meal plan for 1 week, all for free. I will leave the link in the description of this video and also one in the corner of this video. So if you've enjoyed this video, don't forget to like, subscribe to my channel and click the notification bell so that you would get notified whenever I release new videos such as this one. If you have any more questions, leave them in the comment section below. Thanks so much for watching, and I hope to see you in the next video.